Good evening, everyone. A very warm welcome to all of you joining us today. A woman is often called the heart of a family. She nurtures, supports, guides, and gives endlessly to those around her. Yet, very often, in caring for everyone else, she quietly forgets to care for herself. Today, on the occasion of International Women's Day, we pause to remind every woman that her health, her well being, and her happiness truly matter. When a woman is healthy in body, calm in mind, and strong in spirit, she becomes a source of strength and harmony for the entire family and society. With this beautiful intention, I warmly welcome you all to this Women's Health Awareness session organized by Gitananda Integrative Therapies Academy. To begin this meaningful session, we have a special message from a chairman of Gitananda Integrative Therapies Academy, Dr. Ananda Balayogi Bhavnani sir. Let us now listen to his introductory message. Hello, I'll share my screen now. 1 minute.
It is not audible, Kritika.
Was it? 1 minute. Hello.
Yeah, it was not audible.
Oh. One minute. Can you please check if it's audible now?
No, it is not audible. It's okay.
Is it audible now, Nilachal?
No, it's not audible.
Namaste, Vanakkam, Swagatam. Such a pleasure to be with all of you on the occasion of this awareness program being conducted by GITA, the Gitananda Integrative Therapies Academy. I congratulate our directors, Yoga Sadhaka Anandraj Bhavanani and Yoga Sadhaki Sagalakala Valli Divyapriya Bhavanani on these initiatives. And I appreciate the dedicated efforts of our CEO, Yogacharini Nilachal, who is doing his best to take this message to all of you. GITA is based on the principle that yoga and allied therapies are the way for us as a human being to grow into our holistic potential. Physical, mental, social, emotional, spiritual, and why not also financial health, is vital for every human being on this planet. We must make sure that each individual receives those therapies that are appropriate to them in the appropriate way, in the appropriate manner, by the appropriate qualified, competent people. This is why at our GITA, we are taking forward these awareness programs so that all of you can understand our mission and vision. Why are we taking this forward? To reach each and every human being who is seeking care, and not just ordinary care, but loving care that comes from a noble place in our heart. Awareness is vital for us to grow. We have to be aware of our suffering if we are to transcend it. We must be aware of our problems if we are to solve them. And of course, we must be aware of our potential if we are to grow into it. I wish the successful conduct of all these awareness programs, and I also appreciate deeply all our resource persons who are highly qualified and competent in their own field. And I thank you all for supporting GITA as we move forward step by step, doing what is possible every day, so that one day when we look back upon it, we will see that we have indeed done the impossible. Loka samasta sukhino bhavantu, sarve jana sukhino bhavantu. Om Shanti Shanti Shanti.
I would like to thank Dr. Ananda sir for those inspiring words and for setting the tone for today's session. To help us understand the wonderful work and initiatives of the Academy, I now invite the CEO of Geethananda Integrative Therapies Academy, Nilachal ji, to give us a brief introduction about the activities of GITA.
Thank you, Kritika. And as Dr. Sir was mentioning in his message, that like Gita and the Integrative Therapies Academy has its vision with the awareness, and the person who is coming for any help in any whatever condition they are suffering from, they should get their therapies in that form, and integrating the concepts of yoga as the base of the principles in that way. So that objective is just like to give a very brief about Gita, what it is. So as the Gita acronym says, Gitananda Integrative Therapies Academy. So it is a lineage-based tradition where we are trying to integrate the concepts of the tradition in the modern context. So the lineage has the teachings which actually is needed in the present scenario with the modern other integrative approaches. So in today's session, we have the topic with awareness. We have taken different modalities, different areas, different therapies actually. And here we have today with the Her Health Matters, Women's Wellbeing. So there are many awareness programs we are trying to take, through which we are trying to reach different people who wants different therapies. And in Gita Nanda Integrative Therapies, we are having the allopathy, siddha, naturopathy, dance, music therapy. So these therapies are integrated with the yogic principles, yogic approaches. So this is the basic idea. And in that one, how it all started with the objective to bring different therapies together, the integrative approach. And as it suggests, that it is a dynamic platform dedicated to integrative yoga therapy, where it is a therapy, education, and a way of life, and where the traditional yogic principle and the wisdom comes and meet the modern healthcare approaches, and where when they come together, they make a space where learning, therapy, research, and service uh, emerges. So the core vision of Gita is yoga as a therapy, where supporting health through yoga chikitsa. So all therapies has their own goods and their pros and cons, and each therapy has its own goods and there's some limitations. And yoga as a therapy can be helpful in those therapies, and can be helpful in supportive, preventive, promotive, curative way, and that can be integrated. So that is the core vision. And yoga as an education where we can help people understand the concepts of yoga, and we can train people, we can understand them in a way where they can go to the roots of yoga, the origin where it has all started, and yoga as education where we can teach them what actually yoga is in its purest form, its culturally appropriate form. And last but not least, yoga as a way of life. Yoga is not only about to do, it is to be, what we always listen from Dr. Ananda sir. And to be in that state, we need to live yoga. So, how to be in that living samatvam state that yoga talks about, the balance, equilibrium state. So, that cultivation of the conscious and balanced living. So, 24 into 7, that is the time that we need to devote for yogic life. So, how to build that? So, that is also one of the objective, yoga as a way of life. And it was founded on 24th July 2015. And with the seed, it took time, and it took around 9 years when we have inaugurated recently in this year on 14th July 2026. And it came into its form. We have officially started this academy where we all are coming together to perform the therapy, not only the therapy but the education and the way of life. And it has the integrative healing approach, and with the understanding that yoga is a complete system of healing and self development, and it is centered and integrates different disciplines, allied disciplines such as the allopathy, naturopathy, siddha, music therapy, and dance therapy. And among that only, this is one of the approach and one of the awareness program that we are actually showcasing here, and trying to help understand people that allopathy, when it is integrated with yoga, it can help to understand the well-being better. And as we have the women's day, we have this women's well-being, women's health and all. So these systems, when work together within a holistic care framework, addressing the body, breath, mind, emotions, and consciousness, they do wonders. And definitely, it is a learning philosophy, and this enables the learners to progress gradually with different kind of approaches, with short-term courses, workshops, to therapeutic training and professional competence. And this is the lineage and the leadership that we have seen going back to the Kanakananda Brigu or Kamli Swami ji. When we have the Bengali Tantric tradition and also the Shaiva Siddhanta tradition, so it has roots back to the origin, and through that we are trying to keep ourselves intact and try to integrate ourselves with the modern therapies. So it will help us to bind that. And today, when we try to understand therapy in a broader way, the roots are very much important to understand. And root actually help us to keep ourselves in a way where the ancient knowledge can help us in different therapies. So like the yoga as a yoga, when we go into the depth, we have a lot of concepts with a lot of principles, with a lot of understanding that actually can be implemented in present day scenario. So those are the lineage, those are the teachings in the lineage and the cultural way, in the cultural format. So that is needed. And the leadership that we have uh, is it is the rooted in the yoga Gita, Rishi culture, Ashtanga, Gita and the yoga tradition of Yoga Maharishi Dr. Swami Gitanandagiri and Yogacharini Bhavanani, and we are guided by our dear Yogacharini Dr. Ananda Balyogi Bhavanani ji. And it serves the living platform where students grow into practitioners, therapists, educators, and researchers. So, Dr. Ananda sir has always helped us to understand yoga in its holistic way. When we talk about holistic with W, so as a whole, so that is needed, whole person centric approach where we need to understand people as an individual. So this is about Gita, that in a nutshell, and I would like to invite Kritika for the upcoming the things that we're going to do in this one. Over to you, Kritika.
Thank you, Nilachal for giving us that insightful overview of the work being done at GITA. We now move to the core segment of today's program. It is my pleasure to invite a special guest, Dr. Lothikha, an accomplished gynecologist with an MS in obstetrics and gynecology and a fellow in gynecologic oncology from Narayana Health, Kolkata. Having her here is also a pride moment for us as she has been part of the Geetananda family right from her childhood. She will be sharing valuable insights on important aspects of women's health. Yes, Dr. Lothikha ji, we warmly welcome you and invite you to begin your talk.
Um, Namaste, everyone. I hope I'm audible and I'm visible.
Yeah,
Is am I being clear in the communication?
yeah,
Is there
yeah.
any problem?
No, no.
Right. Okay. So I'm no special guest. I'm just like all of you, a part of Gita. And thank you for that warm welcome, Kritika. So today is a very special day because
You're not audible now.
Maybe some internet issues. I think she will be joining again. Yeah.
Auntie, video হচ্ছে না aunty. Video
Now
হচ্ছে
it is audible. It is audible, Lothika.
Now it is fine, ma'am.
নেট একটু ব্রেক হচ্ছে can everyone see me, hear me?
Yeah, we
Yeah.
can see you and hear you.
Okay. Right. So let's move on to the topic discussion today, women's health. The slides, please. Can we move on to the next slide? ठीक இதுக்கு முன்னாடி slide. So I just the previous one, ma'am. I can't take much. Right. So a woman's menstrual health, first of all, is a direct reflection of her overall health. You know, if a woman is not bleeding every month, then it means there's some issue which is happening with the body. If she's having a regular period, which and she's having a bleeding around 5 to 6 days a month, and there's not much pain or bearable pain, there is no bleeding between the period, there is no bleeding post her menopause or post coitus, then her overall health is she's doing well. If this is not happening, then the hormones in the body are not functioning. The hormones are not doing the right work, which starts from the hypothalamus to the pituitary and the response which is happening in the ovary. There is some issue in this cycle. So the menstrual health and uh, having enough awareness of this menstrual health is crucial. Next slide. Next slide. These are some of the few causes. Previous slide, no? So these are some of the few causes which can result in irregular menses or irregular bleeding. It could be a polyp or adenomyosis or fibroid. It can be because of malignancy. It could be because of a bleeding disorder in a woman, or it could be ovulatory dysfunction where the hormones are not produced enough from the ovaries, or it could be because of a drug which is prescribed by a doctor, which is iatrogenic, which we call iatrogenic. Next slide. And dysmenorrhea is uh, is sometimes associated with menstruation. In some women, I mean, most women will have some pain during menstruation. If that is bearable, then it is primary. If it is not, if it is very severe, so much so it requires medication, it requires some treatment, then it is secondary. It is always due to a pathology. And you need to find out what kind of pain you are having during menstruation. Next slide. Endometriosis is one of the most recently, which is coming up, and which is one of the most important causes for dysmenorrhea or pain during menstruation. And this endometriosis is nothing but when your period blood, instead of passing through the cervix into the vagina, if it passes through your tubes and gets deposited in the pelvic peritoneum or in the ovaries or anywhere inside your body, then it is called endometriosis. And that can result in severe pain every time you have a menstruation. Eventually, even without your period, you can have pain because of all the consequences endometriosis is causing. Next slide. Next slide. Most of the time, us women are taught to tolerate pain, and we judge ourselves by the by how much we can tolerate pain. But should pain be always tolerated? Sometimes this pain can be subsided with just painkillers or analgesics, but sometimes you have to go for a higher option like oral contraceptive pills. And yes, oral contraceptive pills are safe. You can take ideally 10 to 12 cycles per year, and up to 4 to 5 years you can take. There is not much weight gain due to the side effect, I mean, or the side effect due to the contraceptive pill. It could be mostly due to your lifestyle. And the side effects are usually nausea, nostalgia. If it is not supervised, or if you're taking a higher dose without any supervision, then that can result in thromboembolism. But overall, if it is prescribed by a gynecologist, oral contraceptive pills are mostly safe. And this is what we usually prescribe for pain during menstruation, or even for endometriosis. Oral contraceptive pill could be a very good option. Next slide. Next slide, please. Now, PCOS, the previous slide. Can we have the previous slide? So, PCOS is nothing but polycystic ovarian syndrome or polycystic ovarian disease. Initially, they thought it was because of some issue which is happening with the ovaries, and they named it a disease. But eventually, with better understanding of the pathogenesis of PCOS, We understood that it is an amalgamation of a lot of symptoms and complications together, and hence we now call it polycystic ovarian syndrome. And where does polycystic ovarian syndrome start is because of our lifestyle and the kind of diet we take. And the stress factor is, of course, a very crucial factor which is causing polycystic ovarian syndrome. And what does all that result in is hormonal imbalance, hyperandrogenism, and insulin resistance, which are three important features. Because of your insulin resistance, insulin resistance itself can cause PCOS also. There is a lot of hormonal imbalance. Uh, the patient doesn't ovulate, hence there's going to be irregular menstruation. There is hyperandrogenism where there's going to be increased testosterone, as a result of which there can be acne, hair fall in the women with PCOS. So the prime clinical features are hirsutism or acne, which are features of hyperandrogenism, oligoanovulation, irregular menstrual cycle, and subfertility because of uh, not regular ovulation in a woman, and metabolic features, which is obesity, insulin resistance, and all. But eventually, what happens is they can have, over the years, they have a long-term complication, a lot of complications, including cardiovascular diseases, early onset hypertension, early onset diabetes, early onset endometrial hyperplasia, which can eventually result in endometrial cancers. Now we are seeing women with endometrial cancer in a much younger age because of PCOS, which because of all the hormonal imbalances it causes. Next slide. Okay. So just as I explained before, these are all the polycystic ovarian symptoms. Could be irregular cycles. There can be weight gain and central obesity. They usually have difficulty in losing weight, excessive hair growth, acne, infertility because of no ovulation, and endometrial hyperplasia because there's no ovulation. The progesterone hormone, which is protective to the endometrium, is not being secreted. For a long time, the endometrium or the uterus is exposed to an estrogen, and hence there's endometrial hyperplasia. And it is definitely not that PCOS is going to be in obese women. There's a term called TOFI, which is thin outside, fat inside. TOFI. Now, lean people also can have PCOS. So, hence, we understood that PCOS is mainly a lifestyle disease and a dietary and lifestyle disease. And of course, stress is also another component which is resulting in PCOS. Next slide. Next slide, please. Yeah. These are the few skin changes that we notice in PCOS. Acanthosis nigricans, male pattern hair loss or alopecia. There can be acne, there can be hirsutism. Hirsutism is where they have hair in the upper lip, hair in the cheeks, chin, sometimes the entire body, they can have excess hair. And acanthosis nigricans is a sign of insulin resistance, where there is blackening. You see in the first image where there is blackish discoloration in the neck area. It can sometimes all in the flexure regions, meaning sometimes in the armpit, sometimes in the inner aspect of your thigh, which is this blackish discoloration, which is called acanthosis nigricans. These are all skin changes which are noticed, which are evident that someone is having insulin resistance or facing some issues like PCOS. Next slide. Next slide. Next slide, please. So how do we tackle this polycystic ovarian syndrome, which has become an epidemic now, where a lot of young children are coming to us with PCOS, not just young children, even women in the 30s, 40s, and have these effects of PCOS. How are we going to tackle? Now, we've understood that it is a lifestyle problem. So you tackle it that way. You change the lifestyle. Have healthy diet, have healthy practices. You exercising is a very good option. We, of course, advise every woman to first start exercise, and lifestyle modification is the uh, you know first change that you'll have to make in PCOS. And I can't stress how yoga could be helpful in dealing with this polycystic ovarian syndrome. I have heard a lot of women who come to us and say that they have practiced yoga and they didn't even need oral contraceptive pill or metformin for the management of PCOS. So, yoga is a very good option, which will reduce the need for oral contraceptive pills or metformin, and it will of course help in um, changing your mindset and helping in changing the way you look at yourself. When it comes to PCOS, there is going to be a lot of body shaming, there's going to be a lot of uh, self criticisms, and yoga definitely helps in the way you look at yourself. And yes, of course, apart from the exercises and lifestyle modifications, oral contraceptive pills and metformin can be really helpful. Next slide, please. Next slide, please. Yeah. So previous slide. Previous slide, please.
I think it is visible, isn't it?
It is.
Can you hear me?
Yeah, maybe you have a weak internet connection. It is, I think, visible. Uh,
Actually, it's connected to Wi-Fi.
mm, Effect of a structure is there, right? It is visible.
Can I have the previous slide?
Mm, I think. Can you see this slide now? Kritika, can you confirm like either the slide is visible or not?
It is visible.
Yeah, yeah, it's visible. It's visible now. Can you hear me now?
Yeah, yeah, we can hear
Yes,
you.
ma'am.
Women's health.
Uh, you're not audible, Lothikha.
The effects of stress.
Yeah, now it is fine.
It's fine.
Yeah, we can hear you.
Right. So the effects of stress in how stress affects women's health. Of course, from your brain to your toes, everything can be affected because of stress. There can be hair loss. There's going to be low back pain, muscle spasms. There could be gastrointestinal issues, which could be irritable bowel disease. There could be GERDs. There can be eczema, psoriasis in skin, and reproductive issues, which can be menstrual disorders. There can be, irregular um, ovulation. There can be infertility issues. And as far as lungs are concerned, there can be exacerbated asthma. There can be cardiovascular diseases and hypertension. There can be and the next slide. Next slide. So how do we deal with this? First, we can't avoid stress. It's going to be a part and parcel of our lives right from the moment we are born. And how are we going to tackle this? First is make sure you're having a well balanced and nutritious diet. Make sure there's good sleep and rest. Channelize your energy and do creative activities, whatever. Uh, have a hobby for yourself. Keep yourself. Um, make sure there's some creative activity you're busy with. Connect with like-minded people. It's very important to be surrounded by the right-minded people. When I was posted in a village as a part of my post-graduation, I was posted in a village for which is 4 hours from Kolkata, and this was a place where people even dreaded, when pronouncing the name. It was a scary place, very politically sensitive. And that was the place I was posted in, and I didn't have any clue about how it was going to be, what was going to happen. But I have a very good friend of mine who also happened to be my house owner, and we have probably, she's twice my age. So, but she's always someone who will give me the right words at the right time. So she was someone who helped me look at it in a very different way. She said that, why don't you think this as an opportunity for you to help people who actually need your treatment? Why don't you think about how beautiful the journey is going to be? All all along the bus journey, you're going to see beautiful fields. You will get to mingle with a lot of people. You will learn the language better. You will learn the accent better. So she helped me to look at things in a different way. She gave me a different perspective to the same thing which everybody feared. And trust me, that turned out to be one of the best place where I had an amazing gynae practice. So it is very important. The point is that it's very important to have the right people around you, right people who will help you grow, right people who will be supportive instead of escalating an issue, who will help you with the right words and pacify you. So connect with the like-minded people and form a healthy support system. And nothing like a woman having an amazing women support. I've always seen women leaning onto another woman for a similar problem, because the way it is understood is the way they feel heard and seen by another woman is always special. Try to minimize negative thoughts and be more positive. Be consistent with your daily exercise. Exercise, have a routine practice, and learn how to practice meditation, which is your call. But we have our yoga expert, uh, Diadi, who's going to give us a beautiful, who's going to give us tips and practices on how to deal with stress in our day-to-day lives. And I'm really looking forward to your talk, Didi. Next slide. Awareness is everything. So it's been 2 months since I started my gynecologic oncology journey, and the way I look at things now has changed. The way, everything which was considered very small is something I'm looking at with a cautious eye. And I'm seeing cancer patients now day in and day out. We are treating them. We are seeing neglected cases. We are seeing cases who come and tell us, I wish we had known this before. I wish someone had told this before. I wish someone had spread an awareness on this before. So, the next few slides are going to be some awareness about the most common cancers that we Indian women face. Number one is breast cancer. Breast cancer can be simply avoided by a simple self examination. Every day, stand in front of the mirror, make sure you palpate your breasts with a flat of your palm. Make sure there's no lump or swelling you feel or anything suspicious. If anything suspicious, go right away to a doctor. And it is advised that after 40 years of age, it is important to have a mammography done, right? Next slide. If you see any changes in the nipple, if there's any bloody discharge, any lumps in the breast or the armpit, if there's any change in the contour of the breast, if there's pain, these are all warning signs, are considered red flags for breast cancer. Next slide. The next common cancer is a cervical cancer, and unlike the other cancers, cervical cancer is very easily preventable because it is caused by a virus called the human papilloma virus. It is important to have your pap smear taken from 20, 30 years of age. It is preferable if it is 25 years, and from 25 years onwards, you take a pap smear, which is every 3 years, or if you're going to take an HPV DNA, it could be every 5 years. Get a pap smear done. Make sure you go to a gynecologist and get a pap smear done every 3 years. Make sure there is no HPV virus. And a very good news is that we also have a vaccine which can prevent an HPV virus infection, which is called a Cervavac vaccine or a Gardasil vaccine. And another very good news is that from February 2026 onwards, the government of India has started vaccinating girls of 14 years of age, 14 completed years of age, and they are targeting this age and vaccinating all the girls against HPV virus, which is a very good, it's like a milestone fighting against cervical cancer. Next slide. The actual age of vaccination is between 9 to 14 years, but you can get vaccinated up to 45 years. If you're going to take before 15 years, 2 doses would be enough, but after that, it is important to get 3 doses. And it is now understood that a single dose of HPV virus is 90% effective. So make sure you get yourself vaccinated. If you're within 45 years, get vaccinated for HPV virus. Now, HPV vaccine not just prevents against cervical cancer, but all the conditions that will be caused by HPV virus. So, a very good preventive measure against cervical cancer. Next slide, please. And the last but not the least is, my dear women, how to age gracefully. So, of course, everybody is going to face aging. We're all aging. But a certain acceptance has to come where you understand that change is going to be there and you mold yourself according to that. Acceptance is the first factor. The body is going to go through a lot of change with menopause. You are going to face hot flashes, bone loss, weight gain. There can be decreased libido. There can be depression and anxiety. But with the right measures, this can be that aging can be a cakewalk. You can age like fine wine if you take the right measures at the right time. Next slide, please. Osteoporosis is a very common thing that we are facing in women, in menopausal women. So it is important you get a DEXA scan done after 65 years of age and after 50 years if you have any risk factors like smoking or alcohol or there's early menopause or factors like that. Make sure you start your calcium and vitamin D as early as possible, and make sure if you're suspecting osteoporosis, bisphosphonates, alendronate is a very good option, but there are other drugs also. Next slide, please. Next slide, please. Just like I said, make sure there's right diet, right exercise, and focus on your mental health. Take your vitamin D supplements, a calcium supplement. Make sure you get your yearly, annual health checkup done. If I would say start as early as 36 years of age, because a lot of issues have started very that early as well. Now we have we are having better medical management. The advances in medical field is so much so that we life expectancy has increased. So 50 years, if you're going to attain menopause, say even 20 years later, you're going to live. So 70, 80 years, say your life expectancy is. Now you start taking all these right measures, you're definitely going to, the menopause wouldn't be a very difficult journey. Next slide, please. So, yeah, life doesn't stop when you get older. It simply asks you to live it differently. And I have amazing women who lived this and have shown me. And sometimes I think I can't wait to get to my 60s and see how I'll do. Next slide. Thank you.
Kritika.
Thank you very much, doctor, for sharing such important knowledge on women's health. When I called her special, she said that she is just like everyone else, but sometimes it is this very humility that makes a person truly special. Thank you, doctor. Understanding health is the first step, but experiencing well being is even more powerful. We now move to a practical experiential segment. It is my pleasure to invite Yogacharini Diya Ramrakshani, mentor and yoga teacher from the Gita yoga tradition, who will guide us through a session on yoga practices for women's well-being. Diyaji, we warmly welcome.
टिकट मिल जाएगी बिल्कुल बिल्कुल Thank you so much, Kritika. Namaste to all, and thank you, Lothikha. Really, you made us aware of how unaware we are. So excellent informative session. Thank you. Let me just start sharing the screen. Let me know if it's visible. Is it visible?
Yes, ma'am.
Yes, ma'am. Thank you. So, Lothikha was talking about perspective. So, here we are, a yogic practice where we are enhancing our physical, mental, emotional well being. Oh my god, so many things at once. But before we go ahead, let us offer our humble salutations to the lineage of our great gurus. Now, recently in one of the sessions, Dr. Ananda shared a beautiful thought. In India, we often say that men believe they are the head of the family, but they do not realize that the woman is the neck of the family. Yes, you heard it right. The woman is the neck of the family, and this neck quietly supports the head and gently moves or turns it in any direction it wants. So the head may appear important, but it is the neck that determines where the head will look. So in many ways, the woman holds this subtle yet powerful role in families and communities. And interestingly, the human neck is also a very important junction in the body because it forms the bridge between the brain and the rest of the body. So all of the sensory information from different parts of the body, they travel up through this neck to the brain. And all of the motor commands from the brain travel to the different parts of the body through this neck. Yes. And in yoga, this region is given great importance because when the neck is healthy and relaxed, the flow of energy in the body improves. Hence, to support the health, healing, and regeneration of the neck, we have a beautiful yogic practice called Brahma Mudra, which is unique to our Gitananda tradition. So, Lord Brahma enables creation and manifestation to occur. And as seen in this picture, he is traditionally depicted with 4 heads, and this practice is based on that number 4. So, using all the 4 directions. The number 4 is also a number of stability, giving stability to this very fragile and agile region of the neck. So, Brahma Mudra involves turning of the head, to the right, left, up, and down. And you can see these movements demonstrated in the pictures by my younger daughter Niyati. So these movements are done in synchronization with the breath. And when it's done with the breath, it creates psychosomatic harmony. Now, there's this beautiful dance of the breath and the movement happening. But if you do it mindfully, the manas gets involved. And when the manas gets involved, the prana flows. Prana is nothing but the vital energy. Yato mana tata prana. And once prana flows, automatically you start to heal yourself. Restore that sense of ease, sukha. Now the effects of the Brahma Mudra is enhanced by the addition of 4 Bija mantras. Now what are Bija? So Bija is actually a seed. Just as a seed has a potential to manifest into a whole tree, these 4 sounds also, when they are uttered properly, have immense potential to support the healing and rejuvenation process. They also produce vibrations that help us attune to the vibration of health. And when we are healthy, obviously we feel happy and we are in that Sukhasthanam space. So these 4 Bija sounds are A, U, E, M. So A as in Brahma. So that A, it's a low guttural sound. You can try Ah. And then U, so this is the right side. Then U is on the left. So U sound is like Vishnu. You're using all your mouth apparatus out here and it's a labial sound. So it's ooh. Don't pucker it. You're doing it excellent. Very good. Can I see y'all? Ooh. Perfect. You got it. And now E sound. So E, if you can see, Niyati is looking up. So here we need Buddhi. So who gives us Buddhi? Ma Saraswati. So that sound. E. Can I see y'all do E? Excellent. And now the last sound is So we go down and it's like Dr. Ananda says that we make this sound after we had a good meal. It's like, how was the food? It's that relaxing stage. Oh my God. All your head, your mouth, your face just vibrates. Can you try? Excellent. So all these 4 sounds are used on the out breath. So on the in breath, we move away from the center. On the out breath, we come back to the center. So on the out breath, we return to the center, utilizing the vibration and attuning ourselves to a state of health and well-being. Now, benefits. Well, I've been saying so many benefits about Brahma Mudra, and by now you know it supports our neck and spinal health. It also manages stress, mood swings, emotional balance. It promotes mental and emotional relaxation. But One very, very, very important psychological and spiritual benefit of Brahma Mudra is that it helps us develop a wider and more balanced perspective. The one that Lothikha was talking about. We should have this bigger eagle's eye perspective, which encourages us to remain centered while understanding others' viewpoint. So it is like the eye in the storm. You're calm there. Everything else around is going on. But you listen to everyone and come back to the center. And who can do this? You, me, everyone. It's suitable for all the age groups. Anybody can do it. And it helps us to regain that sense of ease, harmony, and simply, it helps us be ourselves again. So, you can perform this minimum 3 rounds, maximum to 6 or 9 rounds in one sitting, and you can practice it in morning, evening, afternoon, anytime. Please practice, please try it. Okay, word of caution for the ones who recently had a surgery of the neck or any injury, and if you have vertigo or PTSD, please practice with your eyes open. So on this Women's Day, let us celebrate the power within each and every woman. That Shakti really comes out through this practice of Brahma Mudra. And very often our minds actually get bound by these limited thoughts. I can't, I won't, I am not able to. And these thoughts quietly, they are binding us, restraining our strength and our potential. So through this gentle awareness and movement of Brahma Mudra, we are actually opening up our neck, our breath, and most importantly, our mind. So with every conscious movement, we shift from limitation to liberation. And as Param Pujya Ammaji beautifully reminds us that this journey is from binding thinking to that freedom thinking, where we all say, I can, I will, I am able to. Can you all repeat? I can, I will, I am able to. Beautiful. So now with all that talking, join me to do some practice of Brahma Mudra. So let's get settled. Let me just stop sharing my screen. Got it. Okay, so let's get settled comfortably anywhere on the ground, or if you're sitting on the chair, please come a little bit forward on the edge of the chair so that you're grounding your feet on the floor. And before we go ahead, I invite you all to first sip some water to stay hydrated, because Swami Gitanandagiri, he says that prana flows on water. So little more. So you all can also sip water. All right. Lots of talking. So you can sit either in Sukhasana, Padmasana, or on your heels in Vajra Asana. And let's just relax our shoulders. We have been sitting since long. So maybe just up and down, circular motions of your shoulders. Your neck, side to side, up and down. Beautiful. And now bring your focus on your chin. Very nice. See, where is it located? And now on your shoulders. And now I invite you to breathe in, lift your shoulders like this. And breathe out with, like as if we sneeze. So it's chew. So let's breathe in, breathe out. One more time. Breathe in. I see that beautiful smiles on your face. Very nice. Because this is not about being serious. No, I don't know how to do that. So yeah, that's nice. Good. And now, shoulders relaxed. Chin. What I invite you to do now is, your chin just jutted forward and back. Okay, we are just preparing before we go to Brahma Mudra. This is called Mayuri Mudra. Very nice. And if we have two amazing dancers here, Lothikha and our Shakti Ma. So they were in our midst. They do it with this mudra. Do you want to show it to everyone? So they go side, yeah. Mayuri is a peacock. So they just jut it. Don't shake your body. Don't move your body. Yeah, that's right. You got it. Yes. Beautiful. So you go from side to the right in circular motion. Then you go to the left. Very nice. Oh my God, I have two beautiful peacocks. Yes, Nilachal bhai, very good. Good job, Bridget. Kritika, I didn't see you. Come on. Oh, nice. Now just feel the neck is relaxed, right? That means it's ready. Good. So imagine there's this not beautiful, there's this invisible string on top of your head that's pulling up, zip, encouraging you to sit nice and tall so you're well aligned. You're not sitting like this. You're allowing the energy, the Shakti to flow when your spine is erect and your chin is parallel to the ground. So focus on your chin and see it is not like this. As Amache says, chin up. Very nice. And now, focusing on the chin, let us just turn our head to the right. Your eyes should be on the horizon. Just turn as much as you can and slowly come back to the center. Very good. And now let's turn to the left. Come back to the center. Slowly and consciously. Now slowly lift up. Feel the stretch. Do not bend your spine backward. And now slowly bring your head back to the center. Very nice. Now chin to the chest. Again, no moving your shoulders. Slowly coming up. Good. Now let's add the breath. So when we breathe in, we move away. So can we try? Breathing in, head turns to the right. Your body is still facing forward, only your head turns. Breathing out, come back to the center. Breathing in, head to the left. Keep your eyes open. Come back to the center as you breathe out. Breathing in, up. Feel the stretch. Breathing out, back to the center. Beautiful. Breathing in, chin to the chest. Out, center. Very nice. Now let's add Sukha rhythm. That means you breathe in and breathe out for the same count. So you breathe in for 6 and breathe out for 6. Let's give it a try. So breathe in and out to the center first. Ready? Relaxed face, relaxed shoulders. And now breathing in to the right. 2, 3, 4, 5, 6. Breathing out, head to the center. 2, 3, 4, 5, 6. Head to the left. 2, 3, 4, 5, 6. Breathing out to the center. 2, 3, 4, 5, and 6. Lift your head. Breathing in. 2, 3, 4, 5, and 6. Breathing out to the center. 2, 3, 4, 5, and 6. Head to the chest. 2, 3, 4, 5, and 6. Breathing out. 2, 3, 4, 5, 6. Oh my God, y'all are doing great. So I think I can add those sounds now. Do you remember? Ah, oo, e, No puckering your face. No tightening. Relax. Let the energy flow. Nice. So let me show you one round. I know you all got it, but still one round. And then we'll do it together. Okay? For this, you can keep your hands in any mudra, but it is preferred to keep your hands in yoga mudra, where you interlock your fingers, integrate them together with your right hand dominant. That means your right fingers are on top of the left hand. Yes. And then you join them and rest them on your lap comfortably. You roll your shoulders, always sitting nice and tall. Good job. So let me show you once. You breathe in to turn your head to the right for 6 counts. And then you breathe out with the audible sound. We breathe in to the left. Breathe out with the sound. Who remembers? Yes. Ooh. And then you breathe in up. The sound is for buddhi. E. And then you breathe in. Breathing out with the sound. All my food lovers thinking about food. Okay, so I did it really fast. Now, it is said that when we add sound, we are able to extend the breath. So can we try for breathing in for 6, but breathing out for 12? 1:2 ratio? Let's give it a try if it's true. Okay? So, interlock your fingers, yoga mudras, roll your shoulders, relax your facial muscles, your shoulders, your neck, relaxed. We got this. Okay, so let's breathe in and breathe out in the center. Ready? Breathing in, turn your head to the right. 2, 3, 4, 5, 6. Breathing out for 12 counts with the sound. Breathing in, head to the left. 2, 3, 4, 5, 6. Breathing out with the sound. Ooh. Ready? Ooh. Breathing in, head up. 2, 3, 4, 5, 6. Breathing out with the E sound. Fourth breath, breathing in, chin to the chest, into the jugular's knot. Breathing out with the sound. If you like, you can close your eyes and feel the difference. So let's breathe in to the right. 2, 3, 4, 5, 6. Breathing out. Breathing in to the left. 3, 4, 5, 6. Breathing out. Breathing in, head lift up. 4, 5, 6. Breathing out. Breathing in, chin to the chest. 4, 5, 6. Out. Last round. This time, as we breathe in and move our head to the right, let's think of the sound. Ah. Breathing out, make the audible sound. Breathing into the left, think of the sound. Ooh, as you turn the head. Breathing out, audible sound, come to the center. Breathing in, head up, think of the sound E as you're lifting with awareness. Breathing out, to the chest. Think of the sound. Breathing out. Relax. Keep your eyes closed and feel these vibrations that are relaxing your head, your neck, shoulders, upper back region, giving you that sense of ease, being at balance. When you are at ease, you are the best version of yourself. Contemplate for a couple of breaths. Soak in this beautiful prana, especially the Udana Vayu that has filled up your neck, your head. Enjoy this beautiful experience. Now slowly become aware of your hands and rub them together very gently, very mindfully. Now slowly rub it a little more faster to create a pranic energy in your hands. A little more faster. And when your palms are nice and warm, cup them on your closed eyes and enjoy this darkness. Now slowly allow your eyes to blink in the semi-darkness. Just blink. You could look your eyes up and down, right to left. Maybe you could make some circles. And now slowly keep blinking your eyes and allow your palms to come off the face and look at your beautiful palms. Join them together and bring an attitude of gratitude to our teachers, our gurus who have taught us such beautiful practices. Grateful. Thank you so much to each one of you for sharing your energy with me. Thank you.
Thank you, Diyaji, for that beautiful and enriching session. Her charm, vibrant energy, and enthusiasm are truly admirable. We could feel the energy flowing, and the happy faces here say it all. We are truly delighted to have her with us today. Yoga becomes truly meaningful when we see its impact in real lives. To share such an experience, I now invite Bridget Ma'am, a student of Gitananda Integrative Therapies Academy, who has been benefiting from yoga therapy at Gita. Bridget, we would love to hear about the experience.
Thank you so much, everyone, for being here. Namaste, namaskaram. And I suppose particularly for nilachal for inviting me to share today. I won't keep you long. I know you've been fabulous staying on a wee bit longer today. But I suppose just to introduce myself, so I am a student of Gitananda for probably about 5 years. And it's as this example will be of integrated care within my own life. I am 62 years of age and am a daily sadhak of Gitananda Yoga, and very grateful to the parampara for where it has brought me, and certainly on my journey, this current journey of illness that I've been experiencing. So very briefly, in December, I experienced a heart problem. There was an arrhythmia, which is an abnormal rhythm in the heart. Mine was very, very fast. As a result of it, I went into heart failure. So I was brought into hospital, and they used a combination of electrical and pharmacological drug treatments to stabilize the heart. I was there for 2 weeks. I received excellent care, but when I was released, while I am still continuing to get outpatients, etc., the the input was very limited. So being left with a diagnosis like that, it can be very scary. So left with that, I continued to do what I consider to be a very healthy, balanced life with my yoga and exercise. I live in a beautiful part of Ireland with my dogs, and our children are very involved in our lives. They've all left, but they come back frequently. But there was something more, and there was something missing. And a very good friend of mine suggested that I try yoga therapy. Now, of course, being involved in the parampara, I was very aware of yoga therapy, but for some reason, never really thought about it for me. And so, and especially so in part of the Western part of the world, there are very few people who will know what even yoga therapy is. There is medicine, there are some paramedical explorations that people will try. But in general, people are really quite strict with how they look at their overall health. And so it was with this in mind that I reached out to Dr. Anand, Ananda, and Dr. Balaji, and Dr. Nilachal has taken over my care on a regular basis now, and I am so very grateful for them. So what I want to give you an idea of is what this has involved for me to this stage, and some of the characteristics about what is happening that have made it so valuable for me at this point. So from a practical point of view, I had a consultation with Dr. Ananda and Dr. Balaji. It was very detailed. It involved my symptoms, my medication, but my lifestyle, how I look after myself. What is my yoga practice? What is my exercise in addition to that? What's my diet, my water intake? And with that, then they were able to put together a program for me. And I have been working with Nilachal. To date, we've done 2 sessions on the yoga mat. It's virtual, and the plan is to do 10 of these. Now, what is it so special about this? In terms of the contents of what I do, there is asana, grounding, there is pranayam, there is nad yoga. And the way these are taught is in a very paced way. It is very much, and I'm reminded constantly to do it at my own pace. There are lots of pauses. It is very breath-led, very thoughtful, very gentle. And I think that also reflects into, and Nilachal will probably be quite embarrassed when I say this, but his very kind, gentle nature. And it's one of the things that I emphasize. I am a psychiatrist. I work with counseling all the time. And I always say, find a therapist that suits you, because there's lots out there, but there's very few that are special. And some people will resonate with you and some people won't. And I think it's probably the same with yoga therapy. So very fortuitously, I was gifted Nilachal to do these sessions with me. And he is very thoughtful, very kind. He's very organized, which is really important in everybody's lives. Very professional, which is so essential for people that we know or even people we don't know, and very therapeutic. And so where I'm at now, it really is an integrated approach. I, of course, take my medication. I will do my scans and whatever needs to be done. I will do what I love, what I enjoy at home. And I have my yoga therapy that really fills in all the blanks, all the gaps. I am feeling the benefit already. I feel I've been heard. I have a program that is just for me, which can't be said about anything really. So thank you, Nilachal. Thank you, Dr. Ananda, Dr. Balaji, and with greatest gratitude to the Parampara.
Thank you, Bridget ma'am, for sharing your inspiring journey. Thank you to our speakers. Before we conclude, Nilachal ji would like to make a brief announcement, so I welcome him.
Thank you, Kritika, and those who are here and those who will be listening later in the YouTube or any other platform. Just little announcements. Like this is the first awareness program that we are having, and similar ways we have a lot coming in this month. And monthly we will be having similar kind of awareness programs like we had today, and we'll have similar in the upcoming months or related to with similar topics, so that there is again in each and every month you have an opportunity to come and get a glimpse of what integrative approach look like when we have allopathy and yoga therapy together. And also we have an experiential session also when we will be coming together in specific dates and halls. So that is there. And also like we have a specific crash courses where we are trying to explore and make other also understand different practices of Gitananda tradition, the practices which are very limited to the tradition, but we are trying to keep it open. And like the Hathinas, the Loma Viloma Kriyas, then various Surya Namaskar practices, then the Vibhaga Pranayam. So these are all therapeutic and we all should know. And as Dr. Ananda sir always mentions, it is like when we give, like giving is most important. So when we give, we get more. So by giving, what he means is it's like 9 o'clock. By giving, what he means is to give the knowledge, share the knowledge so that it can spread in abundance. So everybody can be healthy, and we lack the knowledge. So this knowledge can be spread in abundance and health will prevail. So that is the objective and integrative approach. So that is there. So with those words, I would like to invite again Kritika to conclude.
Thank you, Nilachal ji. As we conclude today's session on the special occasion of International Women's Day, let us remember one simple truth. When a woman chooses to care for herself, she is not stepping away from responsibility, she is strengthening it. After all, you cannot pour from an empty cup. May every woman learn to pause, breathe, and give herself the same care and compassion that she so lovingly gives to others. On behalf of Geetananda Integrative Therapies Academy, I extend my heartfelt gratitude to our respected speakers and all the participants for being part of this meaningful session. Wishing each one of you health, strength, balance, and inner harmony. Happy Women's Day to all the wonderful women who make the world a more compassionate and beautiful place. Thank you very much.
Thank you, Kritika, and thank you everyone for joining. Dev Sena ma'am, your presence makes a lot of difference. So thank you for joining. And in few words, if you can say something, it would be honor for us on this Women's Day.
Hey everyone, happy Women's Day and all the Nari Shaktis out there. Yes. So all of them really given their all three Shakti energies brought together. Yes, Icha Shakti, Kriya Shakti, Jnana Shakti. Yes, from all the way from the Adi Shakti. Yes. So nice to hear our dear, lovely Dr. Lothikha, of course, my dear Diya Shaki. So nice to hear with all of you and our dear alumni of old Yogacharini Kritika to be there to compare, and very nice to hear all from you. Very nice evening. Yes, and take the energy and take the practice so that make the all Shaktis with the real, all three Shaktis become three Shaktis. Yes, every one of them, yes. Icha Shaktiyum, Kriya Shaktiyum, Jnana Shaktiyum, Niye, Mahatripura Sundari Taye, Adi Parashaktiyai, Madamagalum, Icha Shaktiyum, Kriya Shaktiyum, Jnana Shaktiyum, Niye, Mahatripura Sundari Taye, Adi Parashaktiyai, Madamagalum, Icha Shaktiyum, Kriya Shaktiyum, Jnana Shaktiyum, Niye, Mahatripura Sundari Taye. धन्यवाद.
Thank you so much, ma'am. I will finish with the Loka Samasta. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu Om Shanti 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 Om. Thank you everyone. Namaste, Pranam.